Hello, my fellow nurse practitioners. Today is going to be the first of a series. This is day 1 of 30 tips for the new nurse practitioner. And so today I want to talk about how we need to manage a head injury. So let's say you have a patient come in, they had a head injury, and you are wondering if a CT is indicated for this patient. So there are some big indications that we need to be asking about, we need to be looking for when determining whether or not they need to have a CAT scan of their head. So 1, if they have a GCS less than 15, then that is an indication. We know that a perfect score is a 15, so any points that we take off is an indication. If they have any evidence of a depressed skull fracture, so we could be looking for hematomas, a scalp laceration, we could be looking for any step-offs, those would all be indications. Or if there's evidence of a basilar skull fracture, so we can look for that periorbital bruising, so bruising around the eyes, bruising behind the ear, bruising behind the eardrum, if they're experiencing drainage from the ears or the nose. All of that can be signs that they do have a basilar skull fracture. If they have had 2 or more episodes of vomiting, if they have a new neurological deficit, if they are on an anticoagulant, if they experienced a seizure, if they are 60 years of age or older, if they experience retrograde amnesia to the event for 30 minutes prior to the event. So that means that 30 minutes prior to the event, they forget everything that happened. That would be retrograde amnesia. And if they had a potentially high impact injury, so for example, if they're pedestrian versus automobile, this would be also an indication to get a CT of the head. Other things to have on your radar too would be 1, if they're intoxicated, if they are experiencing a headache post-traumatic injury, or if they are experiencing behavioral changes. All of those could be indications for a CT as well. As always, these are just guidelines. Your clinical reasoning should always supersede guidelines, but these are definitely red flags that you need to be looking out for that would indicate that your patient should get a CT of the head without contrast. But all right, that is going to complete day 1 of tips for the new NP. Make sure you follow along for more tips. Bye guys.